So there are 5 pillars of health. The first is exercise, all right? 20, 30 minutes every day, you know, if they can. 150 minutes a week is ideal. So, you know, if you can only work in 4 or 3 days, try to get that 150 minutes in. And it can just be walking. It's the kind of exercise where you are getting just a little bit winded. Not a slow walk, but just a walk where you might, if you're talking to someone, you might have to breathe a little bit more deeply to keep the conversation going. But walking is fine. If you want to jog or do something else, that's great as well. Exercise, diet. Oh gosh, diet is so important.
When somebody comes to your office and you're thinking about exercise and then you're thinking about nutrition or diet, why do you consider that so important?
Well, we are what we eat.
Yeah, that's right.
For the diet, I try to have my patients focus on things that grow from the ground.
Plant-based diet.
Vegetables, fruit, whole grains, legumes, those things are so healthy for us. Things that come in the world with a barcode, not so much.
And the French fries and the fatty red meats and the things that we know are not really good for our health.
Right.
How do you tell people to stay away from those?
Well, I make them think about it. So for example, I ask them, what does a cow do? When you see a cow, what's it's doing? It's doing one of 2 things. It's either eating or it's lying down. That's it. It's one of the 2 options, and that's all they do. So they have more fat in their meat. But when you see a free-range chicken or you see a wild turkey, you know, they're running around doing stuff. Fish are swimming, right? So those are going to be your protein options that have less fat.
So you got to have protein. You could have other kinds of protein other than meat.
Absolutely.
Beans, certain types of other foods.
Tofu, vegetables. There are a lot of vegetables that are high in protein. Broccoli and asparagus. And
there were 5 pillars.
okay, number 3, sleep. Sleep is so important. That's how we regenerate our brain cells. That's how we recover. So sleeping, ideal 7 to 8 hours is what I'd like my patients to get. So I encourage them to get 7 to 8 hours. So we're the only species on the planet that tries to rob ourselves of sleep. You know, stay up late watching movies and then you got to get up early.
And everything that I've read in medical literature says that people are really sleep deprived. They don't sleep well.
So important.
So sleep 7 to 8 hours. Everyone's a little different.
Number 4 is connecting with people. It is very important to connect. The worst form of punishment is isolation, solitary confinement. It's terrible. We need each other. We need to communicate with one another. And this past couple of years with the pandemic has been rough on a lot of people.
It really has, and it's been rough mentally. I'm going to jump to number 5. What is it?
Number 5 is, you want to guess?
Well, you've got social laughter.
Well, that's a good one. That should be number 6. But it's mindfulness, meditation. It's that time when you disconnect from social media, you turn your computer off, and you're just sort of in the moment. So mindfulness, yoga, meditation, prayer, bubble bath, where you're just watching the bubbles pop.
Oh, wouldn't that be fun?
Watching the birds, but you're just watching the birds. You're not thinking about that email or that Facebook post. You're just in the moment.